If you're struggling with endometriosis, C-section scars, or menstrual health issues, you are not alone. Millions of women worldwide experience chronic pain, inflammation, and frustrating symptoms, quite frankly, that impact daily life. But what if there was a way that you could support your body's natural healing process? Well, today we're going to dive into how LymphaTouch, a powerful tool for lymphatic drainage and soft tissue mobilization, in addition to visceral mobilization, could be a game changer for women's health. So let's get started. My name is Dr. Aria Missimer. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian, owner of the Movement Paradigm Integrative Health Center, and we also specialize in women's health. So it is a really important topic for us to help women navigate these complexities of some really debilitating conditions. So we're going to talk about understanding endometriosis and inflammation, how C-section, scars, and other considerations may affect you, lymphatic system's role in recovery, and a case study with a real-life example. So endometriosis and the role of inflammation. We know that endometriosis affects nearly 190 million women worldwide. It's an inflammatory condition where the tissue similar to the uterine lining grows outside of the uterus. It triggers pain, scarring, and immune dysregulation. It's more than just painful periods, and it's more than just PMS symptoms. It's an estrogen-dependent condition, and it's driven by oxidative stress and inflammation and immune dysfunction. So 30 to 50% of women with endometriosis experience infertility, and surgery is a common treatment, but unfortunately the reoccurrence rate can be up to 67%. Chronic inflammation leads to pain, fatigue, and hormonal imbalances, and unfortunately it becomes a perpetual cycle of local inflammation and systemic inflammation. So in women with endometriosis, shows us that immune cells like macrophages and cytokines increase inflammation in the pelvic region. So this is why reducing local inflammation is so imperative, and not just masking symptoms, but truly addressing the root cause. So we do want to make sure we're addressing the systemic inflammation as well, but it's also very important to address the local inflammation. So we can have increased neutrophils and macrophages, high levels of inflammatory cytokines such as IL-1, IL-6, and TNF-alpha. We can have reduced natural killer cell function, and ultimately this is where our lymphatic drainage and tissue mobilization can make a profound impact, helping reduce inflammation, improve microcirculation in the area, so think blood and nutrients, and help to also regulate immune function. So now let's talk about some considerations, with one of the biggest being a C-section. So it is not just a scar. It's a 7-layer surgical procedure that can impact long-term movement, pelvic function, and even contribute to endometriosis. Essentially, they're cutting through the skin, subcutaneous tissue, the fat, the muscle, the peritoneum, the uterus, and then the amniotic sac, and then they reverse that order as they come out of it. So one of the common issues is that they can have post-C-section is, of course, scar tissue that's restricting movement and mobility, pelvic congestion and discomfort, bladder and uterine dysfunction, and painful intercourse. So this is really common after a C-section. C-section scars can also contribute to poor uterine mobility, contributing to misalignment, pain, and even menstrual irregularities. This is where manual therapy and LymphaTouch can come into play, helping to release some of these fascial restrictions and restore proper movement of the uterus. Because ultimately, the uterus has to be able to move freely, and it fluctuates with hormones. If it's not moving, then that's when we can have endometrial tissue contributes to this retrograde menstruation, and that can contribute to further dysregulation. So what is LymphaTouch? So it's essentially a negative pressure therapy that is precision based. It works by improving circulation, lymphatic drainage, soft tissue mobility. It can significantly reduce swelling, break down scar tissue, and improve overall tissue health. So it is a very, very powerful tool that can be used in conjunction with manual therapy and visceral osteopathy to really address very, very specific issues. So the negative pressure ranges, we can do a pulsed or continuous mode. We can use vibrations, so different hertz for deep versus superficial layers. And it can really help, especially in a situation like this, of reducing pelvic congestion, this urogenital inflammation, promoting lymphatic detoxification, and also thereby supporting estrogen metabolism and hormonal balance, enhancing soft tissue mobility for improved function. So think of it like when a deep tissue tissue massage meets lymphatic therapy. So it can stimulate at a cellular level and can be really profound in the outcomes. So let's dive into a specific patient that I worked with. And this was a complex case of endometriosis, infertility, as well as a lot of pelvic irregularities. So this was a patient who's 34 years old, presenting with adenomyosis and endometriosis, severe menstrual pain, traumatic C-section, and her main complaints were chronic pelvic pain, painful intercourse, and debilitating menstrual symptoms. So we utilized different modalities, such as the LymphaTouch combined with the visceral mobilization. So before treatment, she had severe cramping and clotting, pelvic heaviness and congestion, painful intercourse. She had a retroverted uterus. And after we utilized the treatment, so we integrated again a variety of settings from LymphaTouch, and we focused on the circulatory aspect. So her pelvic congestion decreased after the first session. After the second session, she had reduced pain with intercourse. After session 3, she had reduced bloating and improved period symptoms significantly. And then after 4, she had no pain after sex. So in 4 sessions, she had 80% reduction in menstrual pain, which was unbelievable. No clotting for her first time in years. She had less spotting, lighter periods, no pelvic heaviness. She had pain-free intercourse. She had increased lubrication. So it was really, really powerful to see in such a short amount of time how we addressed the local inflammatory response and had such profound effects. So these results are really life-changing for many women. So by integrating these different therapies and seeking out these different therapies can be really valuable to help reduce inflammation, improve circulation, restore function without necessarily having to get surgery or excessive medication. And that's really what this is about, that this might not be a cure for anything, but it can be really a way to provide some relief and hope and belief in your body that of its innate capacity to heal. So if you know someone or you're dealing with some of these issues, please make sure to reach out to a local provider. If you're near us, please reach out to us. Of course, we would love the opportunity to help you, but it can be a really, really powerful combination and not only just movement therapy, but promoting healing at a true root cause level. So if you want to learn more, reach out to us at themovementparadigm.com. We would love the opportunity to help you on your journey. You can also, of course, reach out to us via the app. So the Movement Paradigm app on Apple or Google. We have lots of core and pelvic health programs. We have somatic programs, vagus nerve, and so much more. So if this video was helpful, give it a like, give it a share. Of course, subscribe to our YouTube channel. And I look forward to seeing you next week. Bye.